think we've got everyone back in the main room now. So with that, I will pass the mic over to Robin to give a shout out to our annual sponsors. Robin, take it away.
Sure, yeah. So thanks again to our annual sponsors, O3 World, Rosenfeld Media, Vanguard, and Think Company. They make these donations make our events possible, and if anyone out in the audience is interested in becoming a sponsor, shoot us an email. All right, I think that's all for me.
That we will pass it over to Kieran to let you know what we have coming up next. Kieran?
Yeah, we've got some exciting stuff coming up. So next we have an AMA, which is actually going to be on our Slack channel that we do as like in conjunction with Technically, which is, if you don't know, it's like our local tech publication in Philly and in other markets on the East Coast. So this is going to be our first, we've had the Slack going, I think, since the beginning of the summer, but this is going to be our first event that's like specifically on the Slack. So it's going to be with Kent Eisenhuth, who is a data, he does data visualization, and he works, does he still work for Google? Yeah, so he works for Google, and he's coming out with a book. So we're going to have an AMA with him, and it's going to be on our Slack channel. And if you're not part of that Slack, I'm putting the link here, the invite to join it, so that you'll be prepared. But we will be sending more details on that soon over our email. But it's going to be November 3rd from 3 to 4 p.m. Eastern. And then on November 17th, we're going to have our World Usability Day, and look out for a call for submissions on that coming soon.
Thank you so much, Kieran. And with that, we are going to pass it over to Remy to introduce our speaker tonight, and then we will get tonight's event underway. Remy?
Thank you so much, Ben. Hi, everyone. I am really, really excited to get to introduce you all to Fredric V Freeman, who I actually know from grad school. He was doing VR work even back then. And he currently works for Nemours Children's Hospital in Delaware, where he serves as a co-PI and creative director of their virtual reality design and development. And it's on a clinical trial for a VR educational tool to improve health outcomes for youth with sickle cell disease. In addition to his work at Nemours, he's also serving as interim faculty of graphic design, web development, and virtual reality at Sam Houston State University as part of the College of Arts and Media. He's the CEO of his own boutique creative agency, KUZU Creative House, and he's also the co-founder of the XR Health and Humanities Lab at the university where he teaches. So without further ado, I'm going to pass things on over to Fred.
Awesome. Thank you, Remy. And also, too, I wanted to say thank you to the entire Philly Chi group collective. You know, thanks to Raisha, Ben, Robin, Lauren, Kieran, and of course you, Remy. And it's also so awesome, too, to just kind of see like old alumni from Jefferson doing some amazing stuff, still supporting the community, still doing some great UX stuff in general. So I really, really appreciate y'all just keeping me in mind, too. And with that said, I'm going to kick off the presentation. So today I put together something, hopefully a little bit of something for everybody. So we're going to talk a little bit about reimagining patient education through virtual reality. And again, a little bit about myself. I'm actually, I guess, more of a traditional designer animator, and then kind of went down the UX path. It was funny. I actually worked with Kent before he went to Google. We both worked at Razorfish Health. I also worked with a few other like really amazing early UX designers. Some of the first people I ever met who were like in the UX design field. Erin Abler, she's another one. She actually works, I think she does Google. She does Google's voice, conversational voice stuff previously. So these are some people that really influence like kind of the path that I chose as well. And part of the reason why I got into virtual reality was starting to think about how virtual reality plays into this whole ecosystem, the ecosystem of product design, the ecosystem of using new technology to engage with people. So like was previously mentioned, kind of wear a lot of different hats. I'm the creative director for a project that investigates whether we can use virtual reality to help educate children with sickle cell disease. And it's also a tool that we use to help educate doctors and patients as well. So we're kind of discovering as we like build this experience out that it's not just beneficial for patients, but it's really turning into something that's like super beneficial for patients, their families, and then doctors, nurses. So, you know, it's through the investigative process. I think it's like the investigative UX process that we're starting to really identify good use cases for what we're doing. So some background information, probably in about, 2019, I started volunteering with Nemours Children's Hospital, Delaware. And this was just on my time. I luckily got connected with a doctor who is a lead medical writer there. So she's a former pediatric emergency doctor. And then she transitioned to being a medical writer. And, through just like coincidence and good luck, we were chatting and I had this idea for this virtual reality education tool that we could create. And she was like, yeah, let's see if we can work something out. Let's see if we can set up time where you can come in the hospital. And eventually throughout probably, maybe it was like a 2-year process for it to really start to become something. We managed to start to build out this virtual reality experience. And the point of the virtual reality experience is to provide patients new educational material. So when you go to the doctor right now, you kind of think of patient education material as like, hey, here's a pamphlet, here's a handout, here's a video that you can watch. So what we did is we just kind of like started from the very beginning. We reverse engineered it a little bit. We were like, why are patients responding to printouts and handouts, and why are they not responding to printouts and handouts? So we really tried to find the pain point for how patients were reacting to the information they were receiving. So that was kind of like how the real journey started on creating this application and this product. So what you can see right here is just some photos from one of the workshops we did. So this is me actually working with one of the, I believe she was a nurse practitioner. If she is not, I'm sorry. But I believe she was involved in more of the nursing side as opposed to working on the doctor side. So we had a workshop, I believe it was probably in 2021, where we invited patients, doctors, healthcare providers to come in and check out the virtual reality experience we were creating. And then through that workshop, we used a lot of traditional UX research methods, a lot of collaborative activity, stuff that you'd probably be really familiar with, card sorting, and then just really tried to identify too some of the issues that maybe doctors had with describing information to patients, and then also some of the pain points that patients might have as far as receiving information from doctors, and then we started to notice that there was like some great overlaps, but then also there was a few areas of like hangups. So while working on the project, we started to realize too that virtual reality wasn't just a way to educate, it was also a way to build empathy between doctors and patients. So there's a different part, I feel like, of UX that goes into constructing virtual reality. And I think it's a part that really, it's more not just about putting on the headset, but it's more the experience leading up to the headset. Kind of like what's the experience in their life? Why have they chose to, even try out something like virtual reality? And I think that's part of the fun. It's like so new and so like new frontier that you're still trying to match up the puzzle pieces between like the use cases and then also what you could do with the technology. So this is a doctor. He's actually trying it out right now. And again, this is another photo from when we did a workshop at the hospital. And then this is Corinna Schultz. She's one of the physicians that works on the project. So she's a hematologist. And she has been invaluable as far as providing real feedback and real information about how this stuff should look medically. So I guess to kind of jump around a little bit, similar to what Remy mentioned, I currently teach at a art school in Texas, art and media. So it's actually, it's funny, their claim to fame, it's art and media college. And Dan Rathers actually graduated from there like years and years ago. So he was a famous journalist. So they have a really interesting journalism and media program. So I think there's part of that lets them be innovative as far as thinking about media and new media in terms of, you know, what's available and how to rethink media. So part of what I did is work with the school to help set up a XR lab. And then through this XR lab, we actually do testing before we test at the hospital, or we troubleshoot some aspects of the VR experience. So just to give you a little bit more info on the actual project itself. So this is my team that I work with. Dr. Amy Hildenbrand, she is one of my favorite people in the world, and she is the child psychologist behind the project. She's also really taken the lead as far as helping with funding, helping organize, and then also really taking the lead on the patient research side. So as far as like being a UX designer and collaborating with somebody, she's my main liaison when it comes to patient research, working directly with patients. And then I also want to just give a shout out to Ben Baer too. So he's the other research coordinator. So when it comes to actually doing patient testing or testing VR, I work more closely with, the child psychologist, pediatric psychologist, and then Ben Baer, who's the clinical researcher. So there's a part of it where, you know, the hospitals in general don't really have like a lot of experience with like, you know, testing VR, doing patient testing. So I think the people we're trying to work with are people who, deal with stuff like psychology. And I feel like if you're, interested in UX, you're coming from a UX background, you understand that there's a huge psychology component to it. And then also research coordinators and people who deal with doing like research directly with participants, patients, users. So those have been some of the really great, teammates that I've had, but everybody has been like so helpful too. Everybody has been just, couldn't have made this project by myself. So Corinna Schultz, like I mentioned, pediatric hematologist, and then Melanie Patone, medical editor, and then Danielle Morley, patient care coordinator. So that's another very interesting part about working on this project as well. Like I think originally when I first started thinking about like how can we reimagine patient education, it was kind of short-sighted. It was before I really did any of the research, any of the like the legit UX research. Seeing what the patients experience, figuring out what their patient journey is, and then realizing too that as part of the patient journey, they're going to meet so many different people at the hospital. They're going to meet a lot of different people throughout their their process of getting healthier and better. And Danielle, her job is to make sure that people are feeling good. She works for something called Child Life at the hospital. And part of what they do is, they also collaborate with different organizations. So I remember she was telling me that they've worked together with companies like Microsoft to help get Xboxes for patients in the hospital. And ever since I kind of heard that, I was like, that's really interesting. There's like this unique opportunity, this unique space where people are kind of in a hospital. And, when you think of hospitals, you think of like places that usually aren't like the most fun. And then you think of like this, what we can do with technology and how we can use it to kind of make people's lives better. So she kind of helped, I guess, spark another light bulb as well, where it was like, how does this play into quality of life for patients, and then also quality of their time at the hospital. And then, of course, Sherman Finch, I've worked with him He's actually the in charge of game mechanics now. So he started off doing some art direction. And then Ali Alvarado, she is the audio specialist and did the voiceover recordings for the VR experience. And then a little bit of background information on the actual condition, because I feel like that would probably help give it a little context. So sickle cell disease, it is a group of genetic diseases, and then it actually changes the shape of your cell. So there's a little diagram on the bottom. You can see a normal red blood cell. And then what sickle cell disease does is actually changes the shape of your cells. So it makes them like stiff and hard. So they can actually like build up, scrape the inside of your blood vessels. They can build up and cause strokes because they're not as like squeezy and bendable. And they produce anemia. And the average lifespan for somebody with sickle cell disease, the life expectancy without treatment is about 54 years. And it affects 1 in 365 African Americans. They're born with sickle cell disease, and it affects 1 in 16,300 Hispanic Americans. And then 1 in 13 African Americans are born with the sickle cell trait, which means you could actually pass on sickle cell disease. So part of why I really thought this project was important too, because it means a lot to me, but then also it's like helping a cause and a condition that might not get as much research funding, but then also too, I think by not getting enough research funding, I feel like maybe there's a part of that patient education is kind of like thought, an afterthought. So I was like, maybe we could fulfill a lot of different needs by creating this project where it's like really high quality patient education for a disease and condition that doesn't receive as much funding. And then we could use something new, some like kind of piece of technology that might be really exciting too for people to try out in the hospital that might not have gotten the chance to try technology like virtual reality before. So that's where we ended up creating CyberCell, Sickle Cell VR experience. And like I mentioned, it's user-centered design with community and, with community engagement at all phases. So, we've produced some of this through workshops, and those workshops again consisted of, we did one workshop with patients and their caregivers. We did another workshop with doctors, patients, and healthcare providers. And then we also did a science fair not too long ago in September, where we did a little bit of general testing with the public. So like usability testing, and then getting like kind of very basic feedback. I would consider it, like gold star sticker feedback if you're doing a little bit of design choice selection, where it's like, all right, pick your favorite design. So that was fun too. And then we've developed this based on empirical research, which just means that, feedback from the doctors, feedback from people like Corinna, Dr. Hildenbrand, Dr. Patone, feedback from them that's all based on fact, it's based on science. And it's our job as researchers and, artists in general to be able to visualize this stuff. Because I think that's the amazing part too. When we were doing a workshop and we were trying to identify, so if you look at this graphic right here, if you look and you see there's kind of like these bumpy like edges on the wall. So that's called micro damage. And while we were doing the workshop, we were doing some like kind of like Q&A. We were doing, draw what you think. So doing their interpretation. And then kind of like at least doing some like card sorting to like figure out like how do you categorize something that you've never seen inside the human body. So from that we kind of realized too that there's no like visual reference for how some of this stuff looks. So we're really relying on the doctor's medical knowledge, and then we're taking that and then we're turning it into something brand new. So we're creating the visuals for something that hasn't existed before. And then with that, I think it's a real, real collaboration, a true collaboration between science, art, technology, and healthcare. So I want to share with you another piece of the project. So this is actually the instructions, the onboarding that we created for the experience. And then through the, we created this onboarding experience, but we also worked with the patients to figure out how we could make it feel like they're invested in it and they're a part of the experience. So this is where I kind of mentioned a lot of this is user centered. And there's also some stuff I have to leave out because, you know, for patient privacy concerns and, you know, the HIPAA. So we can't technically give you everything, but we can also show you just some like cool stuff that we kind of put together.
Hi, I'm Kareem, and I have sickle cell disease. You're about to enter a virtual reality experience made just for us. It's going to be awesome. First, you need to know how to get around. Let's learn how. It helps to know that when you turn your head, you can look all around to check out where you are. And when you want to move, you don't have to walk. Your hands direct the way. The purple laser pointer shows the direction you will travel.
So what you're actually hearing right now is
let's learn how to move.
Somebody with sickle cell disease reading the voiceover line.
You're going to go.
And when we wrote the script, we felt like it was really important to try to include
aim it where you want to go.
Patients, but also include, you know, former current patients, include people who can speak to the condition from a place of authenticity. And that's definitely something where I feel like, you know, if you're thinking in terms of UX, it's better to work with your population. It's better to work with the subject matter experts, which are really the people you're designing for. So I feel like we've got lucky in terms of how we can collaborate with the hospital, but then also how we can collaborate with patients as well. So this was actually, you know, it was okay to share this. And part of this was trying to figure out the best way to make people feel like they're invested in the VR experience before they even get in the VR experience. So this is just some like onboarding videos we play for people before they check out the experience. And now what I'm actually going to show you is just an older version of the VR experience. I'll kind of let it play. Also kind of like check it out the time too. So what we have here is a screen recording of the actual VR experience. And this is what we're using in the hospital for testing.
It is one of the roads your blood cells travel through to reach different parts of the body. Some blood vessels in the body are large, like big highways. Others are very small, like one-way streets. Let's look around and see what's traveling through this vessel. This is a healthy red blood cell. It is soft, round, and bounces like a bubble. Go ahead, reach out and check it out. Healthy red blood cells can bend and squeeze through tight spaces. This is a sickle cell. Notice how it is pointy, stiff, and sticky. Sickle cells have trouble getting through small spaces.
So part of our current research is to actually measure if we can increase patient compliance. So it's the idea of, all right, if we gave somebody a pamphlet, a piece of paper, and we were like, hey, I explain this, you know, pamphlet to you, and if you want to take this medication to help with, you know, your condition in the future, would you be willing to take the medication? And now imagine if somebody's like, hey, here's this VR experience. Do you want to learn about this treatment that you could do? Would you be willing to do the treatment after you check out the VR experience? So that's part of what our research is right now. We're actually just kicking off clinical trial research next year in 2023. It's crazy to say that it's like 2023 is coming up. And what we're doing right now is actually usability testing. So we're testing for bugs. We're testing to see what's broken. And we're just testing for like general quality of the experience itself. So you can kind of notice too that there's different parts of the experience that are a little more active, have a little more information. And the voiceover we designed very specifically to provide information that instead of reading it in a pamphlet, it's almost like guided. So that's another huge part of the experience. And I'm kind of noticing time too, so I want to just keep moving along. So I also saw this post the other day. So the hospital, Nemours Children's Hospital, they actually have they have somebody on staff, Scott Shaw, who's the former director of Wilmington University's Game Design and Development Program. So I'll actually bring this link up because it's great. So what his job is to get basically get like VR headsets, AR, and tablets and gaming systems accessible, make them user accessible for patients in the hospital. Say if like, a patient might be confined to a wheelchair, or they just might, be a little unable to use like the standard equipment the way it's built. So his job is to work as almost a liaison between the hospital and then the patient, to work with the hospital to make this technology more accessible to everybody. So you can kind of see right here, his job is to also play games with patients and sometimes with the staff. So, imagine this guy like comes around and he's like, hey, you want to play Tetris? It'd be like awesome at the hospital. So he also supports the hospital's entertainment VR systems, and then works on projects to build adaptive controllers for implementing use of VR and AR. So again, I thought this was like really, really amazing because it keeps that idea in mind of like, virtual reality is like a total experience, a total user experience, not just like, hey, I'm building this game or I'm building this one thing. And we never refer to it as a game as well, because we really see it as building an experience that people can check out and people can like really take in, almost like, the mix between like a movie and a book. So we also have the lab. So I mentioned before, started a lab at Sam Houston State University. And what the lab is doing right now, you can see our two lab researchers that we hired, Jacoby Green on the left and Sam Devereux on the right. So what Sam is doing is some Q&A, quality assurance. Q&A is later. She's doing some quality assurance, and then Jacoby's just actually working in the program to make updates if need be to the experience. So that's been another amazing part, kind of when I talked about before, like there's an entire team that kind of goes behind just building this one experience, whether it's the doctors or the designers or the lab that actually does some of the testing. So we've been like really lucky as far as all the support we could get, and then also anything that we could do to keep the project going has been great. So if you want to learn more about the project too, just if you have like general questions, more high level questions, and you want to connect with us, there's a link if you go to the Research and Clinical Trials, Cancer Center, and Blood Disorder. And then if you scroll to the bottom, you will find us under CyberCell, Sickle Cell Virtual Reality Experience, and then a quick rundown of the team. I would encourage you to reach out to Dr. Amy Hildebrand, Karina Schultz, Melanie Patone, or you can reach out to me as well if you just want, again, more like high-level general information about the project. So that's just some background on kind of my place right now in VR and healthcare and emerging tech. So, just like, again, a little bit more info on the project. We just got some pretty good funding. So we're going to build out a few more experiences for the hospital. But then also too, we're exploring like a few other ventures and kind kind of seeing where else we could go with just like this one idea of like reimagining patient education. So watch out, 2023, we're coming for you. So UX research meets VR. So I put together some like really hopefully helpful pieces of information for folks if you've done any VR before, or if you're just like kind of, you know, based just strictly in the UX, you know, user research area. These are some things to keep in mind to get started. And like I mentioned, there's some stuff that I can't show. I wish I could show you all the like Figma and, you know, just like card sorting boards we did, but I can give you kind of like the greatest hits of like how we achieve some of this stuff. So remember, you're not just testing VR, you're testing kind of what happens before the experience. You're testing also what happens outside of the experience. So when you're like, oh yeah, we're just gonna like build something in VR and we're gonna test it, you're kind of, you know, you have to keep in mind there's so much more that goes into it. So you have to think about what are they doing before the experience. And with this, I mean, it's like when they're at a hospital, like what are they doing before? Are they just trying to rush to get there, to get to their appointment? Do they have time before their appointment or in between seeing doctors or another specialist? So you're really trying to figure out where this fits in the workflow of their life. And then how can you onboard them fast? So that's why I kind of showed that instructions earlier, that simple video that we made. You know, there's a lot of different ways you could approach onboarding. But for me, I like to just think about it like, how can you onboard them as quickly as possible to have them feel comfortable using the VR experience? I think that's the main thing, you know, just like anything else, you just have to, ask permission and just say like, hey, do y'all feel comfortable trying this VR out? You know, some people get motion sick too, so it's all good. And then how can you assist them during the experience? So I think there's a part of VR where, you know, you put the headset on, you're kind of like blinded to the world a little bit. So how can you make people feel safe and comfortable and open enough to try the VR experience itself? And then what happens after the experience? You know, I feel like if you've ever tried VR, sometimes you take it off and you're just like, wow, where am I? What just happened? That was so crazy. I just like transported to another place. So how can you like bring them back to where they are? And then especially too, if it's like a VR experience that has a message or a goal, how can you like reinforce that in real life? So that's how I like to think about it as far as some like UX, VR, AR considerations. And then also too, I think, how can you get started? This is like an easy one. I feel like this is like almost probably a couple of years worth of research in like one slide for me. So it's like, what is the testing goal? What are you testing? Yeah. Are you trying to test, like for us, our testing metric was like, can we, will people respond to this better than a pamphlet? Yeah, that's like an easy one. That's like just, but also you could be more specific. You know, what's your testing goal? Can I get people to interact with that space in VR for 30 seconds? And then if they interact with that space, will they learn more? So that's just like another way to approach it. And then what are the metrics you're testing for? So is it like, are you testing for, it's not like you could do heat maps like you would do with like, you know, an app or a website. So it's better to like pick a metric now. So I like to base metrics sometimes just on pain points because it's easy. So it's like, all right, how can you, you know, capture how long it takes somebody? So your metric might be like seconds or minutes. And then how will you record or capture your data? So for us, you know, some of the stuff, it's video, audio, because it's a patient. But I can't share that, but I would encourage you to kind of think of different ways to capture data, whether it's like video, audio, you know, even just like doing Excel sheets of like whatever data you need. You'll have access to some data through the headset, but there's probably going to be like only a certain amount that you'll be able to really like grab from the headset. So you'll probably have to do like some of your research outside of the headset and then like collect that and process it. And then how will you process your data? So for me personally, I still use some of the same traditional like, you know, UX research tools. So it's not like once it's outside, once you finish your testing with the VR headset itself, I'd still go about it the same way. And then if you're working with a hospital, you're going to need an IRB. So this is just basically something that says that you're allowed to work with patients. And then also you might need something called CITI training, CITI training. And through that, it allows you to do stuff like work, with patients, patient testing. So it's really about compliance too. So if you're ever really trying to figure out how to break out into this specific area, there are some like things that you kind of have to keep in mind beforehand. And then I put this together too. I will share some of this info. So I can't give you the entire slide because I have to keep some of the stuff like the prototype video. But I can take out a few of the things, and I thought this was fun. So it was a link for folks who want to just like catch up super fast on like what VR is, how to design for VR, but more from like a UX perspective as well. And it's good because this is a stock photo and I've seen her before, so I can trust it. I guarantee that these people probably know what they're talking about. But I thought this one was cool. This one's like a little bit older, but personally for me, I feel like some of the older VR information is actually maybe even more relevant now than it was when it came out. So say, for example, there's this great video, John Carmack. I feel like he was like in charge of Oculus, but now I think he's like kind of an advisor. He stepped down like not too recently ago. But he talks a lot about mobile VR, which is kind of where I was aiming myself because, the Oculus Quest is like a mobile VR headset. The Pico 4 is a new one that's coming out. It's a mobile headset. So if you can create mobile VR experiences, ultimately, you're kind of doing what the smartphone could do too, just in a new way. And I'm kind of checking out time too. So some key takeaways are metrics matter. So doesn't matter what data you collect or how you collect that data, through consent, of course. The metrics matter. So collect as much data as you can, but do it, in a mindful way. And it's a whole new space too. So when I say it's a whole new space, I mean, you're not designing flat experiences anymore. Eliminate bottlenecks. So when you're really thinking about what can I test? Start with your bottlenecks. Start with your kind of like the points that people might be having the most trouble with. And then what's the goal? What do you want your user to actually accomplish? This is an easy one. I feel like as long as you can figure out the goal, start from there and build around it. Encourage opportunities. I think this is like one that we've really started to embrace a lot. I know, sometimes people kind of promise like everything with VR, but I think if you can encourage like baseline opportunities that are achievable, you're going to see really good results. I think Beat Saber, that's what they did. They just like, found like a very baseline opportunity. And it's like people want to move around and feel active, but then listen to music too. Low fidelity is very rewarding. So what you saw today with the prototype is not where it started. It started at a very, very rough point. So I think it's like, don't be afraid to jump in and just start with something low fidelity. Workshop when possible. So like I mentioned too, a lot of the stuff that I showed you today, a lot of the content was, the product of workshops too. So rely on your subject matter experts and then use workshops to generate more. And then process with traditional UX methods. So, you don't have to reinvent the wheel. I like to keep it simple just because it saves me a lot of time. I can go do other stuff. You don't have to like, come up with this brand new like way of thinking. You can use what you know, but you have to like kind of change the way you do stuff. So I'm going to actually fire up some VR real quick because I want to do a little bit of screen share just to show folks some programs that they can use for prototyping in VR. So if you give me 1 second, I will be right back with you. And then actually, while this loads, So I actually had a lot more stuff I wanted to show, but we'll see what we can get with the time we have. So what I'm doing right now is I'm actually doing a screencasting from a Oculus Quest while it loads up. If you just bear with me momentarily. So what I want to do is actually I'm going to show everybody Gravity Sketch. That's one prototyping tool that we actually use to put together rough mock-ups of environments, user interfaces. So if I can just show you real quick, here's a photo of an environment we created in Gravity Sketch. And this was collaborative. I actually did this with the lab in Texas, and I was actually based in Pennsylvania at the time. And there was 2 other students, and we all built this entire space together. So what I'm going to do is I'm going to bring up Gravity Sketch real quick. Hopefully y'all can see. So Gravity Sketch is awesome. If you're not familiar, it's a bit more like an industrial design tool, and it's more of like a freeform design tool. So it gives you a lot of different options. So these are my controls. So I'm waving y'all right now. And then just to save time, I'll open up something that I started messing around with earlier. And just to show you too, like what you can kind of do. So I put this together before just to make like some kind of like quick idea for user interface in VR. And this is what I was kind of mentioning too. It's like, you're used to like, all right, I got my phone. Let's make some kind of like phone style interface. So we got like a little primitive iPhone right here. So do that. It's very wonky right now, but it's all good. So we got a little kind of like iPhone right here. Let's take this. I don't know. Let's put like a button on it. So we got a primitive. So we're putting like big buttons on stuff. And I think the funny part about VR is like it's nothing like just designing for like 2D. So you can actually get away from making prototypes with stuff like this and be like, hey, this is a prototype, check it out. So imagine you're going around in like a virtual environment, you want to like press something, you're like, all right, I want to get more info. I press that. And then after you press it, maybe like a dialog box pops up. Let's actually make it a little more like a dialog box. So let's do this. Let's change the color. So this is great too. This is a free program. When I was teaching more industrial design style VR, I use this program a lot. But also I'm finding it's great for people who don't have a lot of 3D modeling experience. Like I don't have a lot of 3D modeling experience, but I have enough where I could put together an idea and be like, hey, this is my idea. And you can take it to a 3D designer, or you could just put it in a program like Unreal or Unity, and then you could start to build from there. You can export 3D objects out of this program too. So if I go here, let's see, export. So if I click export, I'll get all these different export options. So OBJ, if you're familiar with that format, FBX. And you could actually connect this to your, let's go back in. You could connect this to your, your desktop PC as well. So we got a different view of everything. So if I kind of jump back over here, you could see that it's the idea of if you're creating these new interactions in these new spaces, you got to think of new ways to like engage users. So for me, this one on the right, maybe it's a video, maybe it's something that has like a little bit of text on it. The one on the left could be like a user profile. And then maybe in the center, that's where you want the user to like actually interact with stuff. So you want them to pick that up. So if I was doing some user testing and I was like, hey, maybe this is like a new way that we could present like information, like a video, maybe it's for a product. I would ask the user, I'd say, hey, can you, identify what piece you want to look at first, or what piece you want to touch first, just to figure out like, all right, I'm not too familiar with how people would interact with the space. What attracts them most to like, looking at information in 3D. So that's kind of how I approach using programs like Gravity Sketch for VR. Let's see if I can open up one more real quick, just while we got time. Yeah, let's exit to the lobby. So I made this one a while ago too. Yeah, this one was zany. I really liked what I did here. So this is thinking about the, rethinking the idea of like, all right, interfaces, do they always have to be flat? And then when you're playing a video game or something, interfaces are usually a lot more dynamic. So how can we work that into, new interfaces for these like 3D VR, 3D web experiences? So I created this idea where it's like, all right, maybe if you've ever played anything on the Vive or, what was that? The Labs game that was originally on Steam that came with Vive. So if you remember, people would pick stuff up and they'd put it up to their head and they'd be transported to a different world. So you're really thinking about how is information presented in a new way, and then how are you like encapsulating that information. So this is one way that we kind of, it's at least one way that I thought would be like something new and something creative. And then this was just some kind of weird like dialogue box style thing. Was really inspired by museums too. You walk up to it, you press a button, and then it would activate the video. So that's like another way to think about it. And again, a lot of this stuff you can just export out to other programs. So then you could actually put it in VR. And I can't see what time it is because I am in VR. 7:49. So I'm actually going to jump out of this. Okay. So I'm kind of noticing that we're running a little bit low on time. So I want to give folks just a little bit of information about some of the stuff I talked about and what they can use. So creation tools, Shapes XR. If you have Oculus Quest, I believe it's available on a few other platforms too. So check out Shapes XR. It's amazing. It's I feel like Adobe's going to buy it like tomorrow. But I feel like this one is really a little more UX friendly than Gravity Sketch. I feel like Gravity Sketch is a little bit more like a little more industrial, but Shapes XR I feel like is a little more accessible. So check out Shapes XR if you want to get started, just kind of like messing around, creating VR experiences or mocking up, assets and interfaces. And then Gravity Sketch, that's what I just showed you a minute ago. Me personally, I love Gravity Sketch just because, I don't know, it's like the drawing tool in it is a little different. So you get to sketch things a little bit more. So it's more of a sketching tool. I use it again for very rapid prototyping, enough to show like somebody who's working on a project with like, hey, check it out. Can we use this? Can we build this? Do you think like people would interact with this? And then also I'm just including a Unity. So definitely if you want to get started doing a little bit more like UX VR stuff, I would jump straight into Unity. Like, don't be afraid. Go straight to the programs that are also what you use to publish VR. And then also Unreal, of course, I would experiment with that a little bit. Unreal is becoming a little bit more of like a super hybrid program. So that's fun too. People are using it for live cinema, live mixed media. So I think Mandalorian was filmed a lot using Unreal for like 3D composite. And then also Blender. So if you're, I think Blender is great too, because it's a free 3D modeling program. There's so much support out there as far as like teaching people how to use Blender. So if you need to create assets, I would check out Blender because it's like, it's free and it's a good way to start just creating stuff for VR. And again, I'm including 3D programs because I think that's the main difference between like what VR can do and what traditional technology does. You know, you're working in 3 dimensions as opposed to your traditional just 2 dimensions. So some key takeaways are experiment. You know, don't be afraid. Just kind of like jump in there and see what you can make. Pretend like you're making something and you're going to send it to your mom. She's going to put it on the refrigerator. You know, be okay with just like, all right, I made this today. So I kind of got started by making like weird VR interfaces and stuff, you know, for my projects by just making like one thing in Gravity Sketch a day. So also keep in mind, if something is flat in VR, it's paper, it's 2D, you know, just like Post-it notes are like flat. If you're going to make like an interface or something for people to interact with, if it's flat, it's going to be just like paper. Field of view matters. So how far away people are from stuff, the depth of view, that really makes a difference. And then use the space. Don't be afraid. Like I kind of showed you those kind of like wild and different interfaces. Don't be afraid to make something that like wraps around people. You know, I think another good reference is trade show experience design too. So kind of like research that a little bit if you're looking for like new and innovative ideas. And then VR is great for real-time collaboration. So it's fun to do what it's supposed to do, bring people together in like a virtual world, and then collaborate to make it better, like work together with people. All right, I already did the demo, so we're good. And if there's any time for questions, I'm here.
Yeah, for sure. Thank you so much. That was super engaging. I got completely lost in it. And we had a ton of questions trickle in through the meeting chat. So with that, I'm going to turn it over to Kieran to help field some of our top questions. Kieran?
Yeah, like Ben said, thank you so much, Fredric. This was super informative. And yeah, we went through so much, and we did get a ton of questions, so we won't get to go through them all. Hopefully, people that we don't get through, you know, maybe they can reach out in another capacity. But yeah, so let's see. I'm just gonna jump around a little bit. One person asked, is there any way to measure comprehension of the simulation by kids who go through the experience, as in they understood the connection to their condition beyond it being a video game-like experience?
Yeah, so there is, I mean, there's different, so that's the weird thing too. You have to, what we had to do is find different metrics that might not apply to VR and then figure out like how would that metric apply to VR. So maybe the closest thing would be, you know, how long, if somebody watched a video for 10 minutes, what would their comprehension be compared to if they read a pamphlet? So then we know that it's like, all right, does 10 minutes of VR time equal 10 minutes of like video comprehension? So like on it, like part of our research has been to try to figure out like if there's analogs between those two, or you know, if they're analogous, and then also to figure out like if they're not, do we create a new, you know, measuring system? And I think that's also too where it's stuff starts to come into play, as far as like if you can create your own, you know, you're making like your own algorithm as far as you know, research testing and research metrics. So sometimes some stuff there's nothing out there just yet, which is kind of fun.
Yeah, you're like setting the precedent. Thank you. Another person asked, would an AR, augmented reality, make people feel more comfortable and not too detached from the real world?
So I would say yeah, but also there's a part of me that, you know, my background, like I guess even originally before like doing more UX stuff, was in like animation for broadcast. So I thought of VR as like almost like a movie, you know, it's like a personal movie theater. Like I can put this on, I can kind of transport out of where I am. And then I think you're right. I think the question was right. It's like AR sometimes does make people feel more connected to their environment. But I think, you know, for our own personal reasons and choice, we wanted to make it feel like it's a more personal experience. And I think, you know, that's part of where the AR VR industry is right now. It's trying to figure out like how do people, you know, how do you make people feel connected if it's VR? And then for AR, how do you make it so it's collaborative? It's not just like a single person AR experience. So there's different use cases for each, but I think, you know, some people do it better than others. So it'll be interesting to see what other people do in the future.
Great answer. Here's another one. If your team had to replicate this project for another similar clinical care setting, what would you do differently?
Man, that's a great question. Oh man, I feel like we would do more paper prototyping. So almost more paper prototyping with patients and doctors, and not as like, I think we did some card sorting and some, you know, kind of like brainstorming activities, but I honestly think there's more value in planning out what you do in VR in paper with paper prototyping. So again, I would start probably with just more general paper prototyping.
Cool. Yeah, let's do maybe one more question and then we can wrap it up. Does that sound good, Ben? Okay, cool. Yeah, so how would you possibly adapt this experience for someone who is not comfortable with VR, or how would you encourage them to use VR if they haven't used it before?
You know, it's interesting because I feel like there's, I'm not going to say it's like a generational thing, but I feel like younger audiences are more open to trying VR if they haven't tried it before. And I feel like our, you know, older audiences are more timid as far as trying VR sometimes. And I honestly don't like trying to force people to try it if they're not like interested in it, just because, like, you know, I feel like it'll create like a bad experience. So I think there's part of it where, you know, you kind of have to design it and then make it feel accessible. I think that's like the real gold. You know, if people don't feel like comfortable and able to access what you built, then it's not really as useful as you want it to be. So for me personally, I would just try to explain to them as much as possible about what's going to happen. Similar to like how a doctor talks to you before like a surgery. It's like, hey, check it out. There's this VR experience. You know, you're going to go through a vessel, blood vessel. You're going to see some cells. You're going to have control. You can take the headset off whenever you want. So really being like upfront with people and providing them that information. And I think that's why during, you know, the talk, I tried to mention that a lot of the user experience itself with VR isn't about what's happening in the headset. It's about like, you know, getting people ready. And then what do you do after they're done? So I think if anything, it's really like focusing on, you know, empathy. I think that's where like another big empathy part comes in. You know, if you can build a strong enough connection with them, then they might feel more comfortable trying it.
Yep, totally makes sense. Thanks so much. And
Yeah.
I think we're gonna move on to Raisha now to announce the raffle winners.
Yes, I have the winners' name with me. So give us a shout out on the chat. So the first winner is Jeff Ritchie. The second winner is Valerie Beck. And the third winner is Babs Hansen. Congratulations to you guys. As I mentioned before, we will follow up with you by email to coordinate about the addresses, and we'll send you the physical copy of the book, no matter where you are in the world. And now I'll pass it on to Ben to wrap up.
Awesome. Thank you so much, Fredric, for your talk tonight. I hope everyone really enjoyed the presentation. I know I got completely lost in the virtual reality and the presentation and all of the great resources as well. And again, thank you, Fredric, and each of our annual sponsors for making tonight's event possible. And thank you for everyone attending and sticking around for all of our technical difficulties and staying with us. And with that, I bid you a good night and stay safe, stay healthy, and stay connected.
Bye, everyone. Thanks for coming.
Bye, everyone.